Hello, I am Dr. Mark DePaolo. Thanks for joining me today as I teach you how to perform a preliminary neurologic exam. The goal of this video is to give you the knowledge of when it would be appropriate to call your veterinarian and ask that they perform a neurologic evaluation on your horse. Neurologic diseases are typically diagnosed by exclusion. This means they usually get diagnosed after your veterinarian has ruled out everything else, especially in the milder cases. This is time that could be spent treating for the actual disease causing the problem. Symptoms of neurologic disease can be weakness, incoordination, ataxia or drunken walking, lameness, stumbling, decreased performance, weight loss, muscle atrophy, and even injury due to incoordination. Many owners or trainers will say that their horse feels like two different horses, like he's disconnected from the front to back. If you feel like there's something off about your horse but you can't seem to pinpoint the problem, or if your horse shows any of the signs I mentioned, performing a brief neuro exam may help lead you in the right direction. Veterinarians rate how the horse does on each test with a score of 0 to 5, 0 being absolutely normal and 5 being completely neurological. It's typically stated something like 3 of 5 or 3 out of 5, for example. When I evaluate a horse that I am suspicious has a neurologic disease, I always palpate their back first using moderate pressure. I am looking to see if they can feel pressure or pain. Do you see how on this normal horse he reacts by flinching and or pinning his ears every time that I palpate the areas that will typically be sore when a horse has been working or is out of alignment? When I palpate a horse with a neurologic problem, most will act like they are very comfortable in their backs, they don't have chiropractic issues, or they can't feel you pushing on their back. This horse is completely insensitive to touch. He is about a 5 of 5 on this test. Next, I like to check acupuncture meridians looking for hot or sensitive points, especially points associated with the immune system, stress, and those that are inflamed when a horse has a neurologic disease. The normal horse shows no sensitivity to points on the chest or shoulders. It is difficult to see, but this horse is showing some mild sensitivity on the acupuncture points at the front of his chest. These points are sore when the immune system is actively fighting an infection. He is a 1 of 5 for immune point reactivity. This normal horse shows sensitivity over the hip point that is associated with stress, but shows no soreness over the point for neurologic disease. He is a 2 of 5 on the stress point and a 0 of 5 on his neuro points. This particular horse is sore on his left hip at an acupuncture point that gets sensitive when a horse is under stress. For example, when they have rhino or neurologic disease. See how he also moves away when I palpate a point in the center of his hind leg, just over the stifle. This point is usually sore on both sides and is considered to be a diagnostic point for neurologic disorders. He is a 3 of 5 on his stress points and about a 2 of 5 on his neurologic acupuncture points. After palpating the horse, I grab a piece of hay and I check for fly twitch reflex. This is pretty much just what it sounds like. I pretend to be a fly to assess whether the horse can feel it. This horse has absolutely no problem feeling it as I simulate a fly walking on him. At one point he acts like he would like to kick me if I don't stop tickling him. This horse has absolutely no fly twitch reflex. I would consider this a 5 of 5 test. Next, I always check for tail and anal sphincter tone. When you hold a horse's tail up and poke them under the tail or on the anus, they should be able to forcibly clamp their tail down and wink at you by puckering their anus. A normal horse will at the very least twitch their tail every time that you poke the underside of the tail or the anus. Most horses, unless they have had their tail done, will really clamp their tail down against their butt. Sometimes they will even trap your hand there. This horse has a very weak, almost non-existent response to both. He is a 4 of 5. The next test that I feel horse owners should know how to do is called a placing or proprioception test. It involves taking a horse's leg and putting it under the belly, across the midline with the hind legs, or over the front foot with the front legs. You will then watch to see how long it takes the horse to bring the foot back to the normal position. I mostly use the hind legs because they are usually the first and most severely affected. This horse takes only about a second to replace his foot to the proper position. Many normal horses won't even let you put their foot into the wrong place. This particular horse fails the test because it takes longer than 2 to 5 seconds for him to move his feet back to their normal position. He is very comfortable standing cross-legged. He is a score of 5 of 5 on the placing tests. Lastly, I like to do what is called a sway test. This involves grabbing the tail and pulling the horse's hindquarters toward you in order to determine the strength or lack thereof in the hind end. A normal horse may let you pull it off balance the first time, but should be able to resist you firmly the second and third times. Some veterinarians like to do this test with the horse walking while being led. I find I can tell just as much when the horse is stationary. The normal horse resists strongly even on the first pull. He won't let me pull him off balance. As a matter of fact, he is strong enough to pull me back towards him. I am able to pull this horse off balance several times in a row with just one arm. I can easily pull him over on both sides. He would be a 3 or 4 of 5 on the sway test. Neurologic disease can be difficult to diagnose and treat, so starting treatment as soon as possible is very important to achieve a successful recovery. Many neurologic horses will start out by showing symptoms of lameness. It is typical for a neuro horse to have hock injections first. When that doesn't work, the vet will inject the stifles, and then sometimes recommend sacroiliac injections. While these procedures can provide great benefit to horses, they will not help a horse with neurologic dysfunction. I'm hoping by teaching you a very rudimentary neurologic exam that you will be able to help recognize when a health issue is being caused by a virus, bacteria, or protozoa affecting the nervous system and begin treatment as soon as possible. If you are not having issues with your horse at this time, you can perform these tests to have a baseline should you ever suspect that a performance problem may be a neurologic disease. Thank you for joining me today as I teach you a preliminary neurologic exam.